everyone. I'm so excited. I'm Dr. Akita here with Yovanna, and we're going to be talking about a new partnership that we have called the Clarity Reset. I'm a physician and she's a therapist, and we know that mind and body work best together. There is no separation. And so we've talked through the years about the impact of stress and emotional health on physical health, on whole body health. And so we're excited to present the Clarity Reset to you. And if you would tell us more about yourself.
Yeah, I'm really excited to be working in partnership with you, Dr. Evans. Yes, we have been talking about this for quite some time. My name is Yovanna Madhere. I am a licensed master social worker and therapist. I'm licensed in Georgia, DC, and Virginia, and I'm the owner of the Clarity Practice, where I help high
Yes.
achieving women reduce stress, increase wellness, and create balance in their lives. And over the years, Dr. Evans and I have talked about just like kikiing about, like as we mature as women and what does that look like and what does that feel like, and also understanding the impact of stress on metabolic health, which Dr. Evans is an expert
Right.
in, and that's really like her focus with her patients is metabolic health and how mental health and metabolic health actually are more connected than people give themselves credit for.
They
And so
are.
I'm really excited to bring this clarity practice to your patients as well as to the global community. Um, and in the Clarity Reset, we're going to be over the course of about 6 sessions going over the various aspects of our mental health, particularly the things that high achieving women come to therapy for, the things that I see in my practice, boundary setting, communication styles, how to rest, what does rest
Mm.
look like, how to give yourself permission to rest, right? How to maybe change your kind of inner voice and inner thoughts, and a few other delicious things that we're going to discuss over those 6 sessions. So I'm really, really excited to be in partnership with you on this, Dr. Evans.
Yes, as you were talking, I was thinking about the relationship, and we hear a lot of talk about hormones nowadays, and
Yeah.
especially as a lot of women are bringing more voice and awareness to the whole perimenopausal, menopausal time. But a hormone that is often overlooked, in my opinion, is the cortisol hormone and how that relates to
Yeah.
insulin, how that relates to metabolic health. And so we know that short times of stress can be helpful, can be protective, especially if we're in immediate danger. We need cortisol to go up, the stress hormone, so that we can get to safety. It needs to go up and then come right back down. But what
Right.
we're talking about is the impact when cortisol is just up over a prolonged period of time, when there's not that time to rest, and what that does to the metabolic health.
Mm-hmm.
So when you were talking about how to rest, how to debrief, I'm like, yes, all that is needed for optimal metabolic health. You mentioned that is
Mm-hmm.
often the focus of what I talk about of my practice because I know that a lot of our health concerns are tied to our underlying metabolic health. So
Yep.
I'm excited about this partnership and can't wait to hear about people's transformation as they go through the course.
Yeah, absolutely. And, one of the things like you were saying about perimenopause and our cortisol levels that we're going to discuss in the course is what rest actually looks like. As an integrative therapist, a lot of times people think, well, therapy is just you're just talking and you're just, but the beautiful part of integrative therapy is the ability to address the mind body soul connection because as you mentioned at the
Yes.
beginning, we are not separate, right? And
Right.
so our modern lives really unfortunately rewire us, for lack of a better term, in a way that just has that cortisol spike at all times. So when we think we can't lose those last 10 pounds and we start to beat ourselves up, which impacts our self-concept, we think like, oh, I can't
Yes.
lose that weight because I'm a bad eater, I don't work out, etc. But really it's just lifestyle. And so in the Clarity Reset, what we're going to be doing is just addressing some of those minor lifestyle changes. We don't have to do necessarily a large overhaul. It's just minor lifestyle changes that you're like, oh, if I just do this instead of that, that would reduce my cortisol, or that may reduce my inflammation, right? Or that may improve some of my metabolic markers, as well as my output at work, how I parent, how I show
Yes.
up in the world, how I date. And the answer overwhelmingly is yes. And so I love
Yeah.
that like mind body connection that we're always trying to address. I actually have a question about cortisol. Is there like let me go back. Are there what are the most common metabolic symptoms that you see with spiked cortisol in your practice?
Rest that is not restorative, people who are tired all day, even though they went to sleep, or people who cannot sleep the night, something is waking them up at the middle of the night and then they can't go back to sleep. I also see a lot of people, especially women, report increased weight gain around the abdomen. We
Right.
know that that is where the weight will often go. And, saying despite having exercise, lifted weights, eating all the right things, the weight does not go down. We can also see a decrease in mental clarity and cognitive clarity. And so
Right.
it can be like a brain fog, can't see through the cloud. And so those are some of the common things that I see.
Yeah. And to that point, that brain fog, that lack of mental clarity, hence why we called it the clarity reset, um, is a underlying foundational aspect of burnout. I know burnout is like this buzzword that everyone's talking about, but it's a really real thing despite it being like this buzzword, right? And so the
Hmm.
burnout doesn't just come from the stress that we're trying to reduce or the wellness that we're trying to increase or the balance that we're trying to create. It really does come from inside the body. The body is literally screaming from inside, like, I'm stressed to the limit. And so, even though you think you're resting, but because the rest is not restorative, you are in fact burning yourself out. And trying
Yeah.
to fight through that mental fog also contributes to that burnout. And so, we start to see it on both sides. We start to see it on the mental health side, like you mentioned, the brain fog, etc., which again impacts our self-concept. As high achieving women, we
Mhm.
think that like we just have to power through everything, and we end up doing ourselves a disservice. We end up negatively impacting our bodies, right, Dr. Evans?
Right. That's
Yeah.
correct.
How else do you see that show up for you?
I would say it's so interesting. So, like shortly after the pandemic started, I would I was just sitting in office, with patients, and I said,
Mhm.
I'm just treating stress.
Yeah.
I'm seeing stress as it shows up as elevated blood pressure and then hypertension. I'm seeing stress as it shows up as unhealthy blood sugar levels, then prediabetes and diabetes, as it shows up as that weight gain, as it shows up as a sleepless nights. I realized that a lot of the root cause, I'm functionally medicine trained, looked at the root cause
Hmm.
is stress and the effect on the brain and the body. And I think it's a connection that a lot of people make when I give voice to it. They're like, oh yeah, that makes sense. But one reason why, well, I'm grateful for many reasons, but one of the reasons is this reset, this clarity reset is a charted path to resetting, to becoming better. Because often in the office, I can say, this is my assessment. You need to, clear up the stress and things like that. But you're providing an opportunity for women to participate and see real outcomes, to see real
Yes.
outcomes over a relatively short period of time. And so there are two things that I think about. One is the strength of community. We know from
Yeah.
research that people heal better in community. There's nothing like being able to bounce ideas off one another or just
Hmm.
knowing that when you show up for others, they're showing up for you. And
Yep.
so this is something that I think sets this opportunity apart. And the second thing is consistency. You mentioned earlier that sometimes, not sometimes, a lot of times these small changes will add up. And we all have had the experience where we'll do a lot of the little things for a short period of time. But I'm looking forward to women being able to go through the process week after week and hopefully build new lifestyle practices and habits and build that consistency, which will build the self confidence, which will build the new lifestyle changes, which will result in the clarity reset.
Yeah, I love that you said that, and I appreciate that mindset. Sometimes we think that when it comes to a reset or a mindset shift or whatever, it has to be some like, big thing, a ray of, thunder coming down and something
Yeah.
really significant. When sometimes it could just be something as here's something that's evidence-based. Maybe you've been hearing it in the ethers, but here it is packaged in a way that really resonates with you. And
Yes.
commentary, like you were saying, in community that you can make in the safe space where, you can speak your mind, you can show up as you are, come in your moo come deep conditioning your hair, come as you are fully.
Yeah.
And that is part of the rest. part of the rest
Right.
is coming as you are and not having to perform. And so
Oh,
many of
yeah.
us high achieving women, particularly women of color, have spent so much time performing and not realizing that the performance takes us away from our authenticity. It takes us away from our center. And those things over time, so the same way how healing is done over time, unwellness is also done over time.
Oh,
And
yes.
so this is an opportunity that over time and in commentary and in community with others, we can say, oh, you know what? I'm not alone. I'm not crazy. I thought that I was the only one. And other people to be like, no, ma'am, you're not the only one. I just went through that last year, or I'm going through that right now, or, and so
Exactly.
I'm so really, really excited for that from that perspective. And just the ability to serve people. And I'm really excited to see after the sessions, what everybody's blood pressure and
Right.
looks like on the back end of
Right.
it. Yeah. And also having the opportunity to build upon what we have learned as well.
Exactly.
Yeah. I'm
Exactly.
excited about that. What is something that you wished that your patients, I'm sorry, understood about metabolic health and what that might look like before there's a mayday, something's going
Hmm.
awry?
Oh, I like how you phrase that. Because one thing that sometimes I feel like if we would have captured it earlier,
Hmm.
we could have prevented a lot. So it's never too late to address the health concerns, but
Hmm.
we do know that the issues show up way before and often go undetected. And so, for instance, years before prediabetes sets in, insulin is elevated. And so, a lot of times I'm capturing, the abnormalities once there's already prediabetes or diabetes. But, if we had started just doing regular assessments and check-ins years before, some of those things could have been captured and we could have reversed before disease set in.
Right.
So, especially if there's like a genetic history, especially if there are other risk factors, I do encourage people to seek care, just like your regular physical, and maybe ask for labs that are not as standard, but are telling. It can give us information before disease sets in.
Yeah. I think that's critically important when we're talking to people in our community and say, hey, come get your physicals.
Oh,
Come get your
yes.
physicals and please address your stress because as you were saying about things that maybe might be genetically predisposed, a lot of the genetic predisposition, people are not gonna like it when I say this, but it's true. What we think is genetic predisposition, which there's evidence to prove this, but it's
Hmm.
also rooted in lifestyle.
Oh,
And
for
we
sure.
learn our lifestyles through our family, right? Through our communities,
That's
through our
correct.
culture. So it does keep that prevalence of what is maybe genetic, right? At
Hmm.
the top of mind, right? And when we know that in certain communities, it is incumbent upon mom to handle all the things, but mom doesn't delegate, and mom still has to work, and mom still has to do all the things, and mom has not had an opportunity to rest. Mom doesn't know how to delegate. Mom doesn't know how to set boundaries. Nobody's ever taught her. And so then when she comes to see you and her stress levels are high and she's reporting to you, but she's not going to tell anybody else, I am tired.
Yeah.
I'm feeling burnt out. I'm doing too much, right? So here's a clarity reset to offer a respite for some of that.
Yes.
And each one teach one. If we're together, hey, you know what? I'm doing this clarity reset thing and 2 weeks in I feel great. You should join the next session. The next time
Cohort. Hmm.
the next 6 week session, you should join. Let's do it together. And that is how we start to turn the tide of what maybe we consider to be genetic, which is just lifestyle, which is just cultural,
Right.
and just start to kind of turn it and set the next generation, or then teach our children, teach the people in our communities, what you've learned, what they have learned to then set the whole thing better. And what we also know, going back to community, that when we do wellness in community, all ships rise. Everybody does better. Kids do
Exactly.
better in school, right? Relationships overwhelmingly do better. And the health of the parents and the health of the children also do better. So
Yeah, I
while
was
you think you're doing it
sorry.
for you, you're just the one person doing it, you actually end up kind of spreading that light, spreading all that clarity out, and
Yeah.
everybody wins.
Yeah, I was thinking, oh, what a beautiful legacy to create for those that are watching us now and those who will come behind us
A
when
hundred
they see
percent.
that shift. We can change the narrative for the family history as far as it relates to health. And something else that came up, okay. Oh, yes, when we were talking about genetic predisposition, I was thinking there are a lot of estimates that genetics makes up only 30% of disease expression. So
Right.
less than half of the reason disease happens, right? So 70% is because of lifestyle. So to
Hmm.
your point, we're in control of a lot. I often hear, oh, it ran in my family, it ran in my family. Well, it could stop with you.
It can stop
And
you.
thinking about the effect of stress on all of these chronic diseases, this is an opportunity to take inventory and also to change course. So, yes.
Also to change course, absolutely. So I love how you mentioned that about setting the legacy and the reduction of stress, and again, what that looks like in our communities and in our families and for ourselves. And one of the things that we're going to be tackling in the Clarity Reset is our identity to stress,
Hmm.
and how some folks feel like if I am not stressed, then I mustn't be working. And one of the topics that we're going to talk about is, without having to get too deep into it, is am I worthy of resting?
Hmm.
Do I need stress to function? And like you mentioned at the very beginning, yes, if a lion is chasing you, you need stress.
Mhm.
And yes, stress is actually, to an extent, good for the brain. It's good for us to experience stress because that is how we grow, that is how we solve problems, that is how we, kind of push forward and handle our business. But there's a difference between using stress effectively, which we'll also discuss in the clarity reset, because there's a way to effectively use stress, and just be in this perpetual state of stress. And also, what is good stress and what is bad stress? Because I feel like stress overall is can people can kind of get a little bit confused, but and there's good stress and bad stress, and so how can I use either to my advantage and for how long?
Yeah, you were mentioning earlier, like how high functioning women are often, especially women of color, are often in performance mode. And
Yeah.
just the burden that comes with carrying that. And so I think about toggling between performance and just being
Right.
and getting to
Yes.
the place personally, professionally, emotionally, where it's enough to just be who you are, and show up because that can be a great relief. Yeah, there's so many sources of stress. When I talk to people and especially women in the office, I'm always wondering how much are we putting on ourselves. I would say unfairly, because some of us are carrying weight that isn't ours. And so
Sure.
I hope that women really take an opportunity to dissect all of that, put down what can be put down, carry what belongs to you in a way that does not burden you, but that enlightens you, that frees you up to create and to be, and then see the transformation in your health and your life and how you interact with the world. A lot of times when we're so stressed and we're so stretched, and so pressed, that affects how we show up to the people we care about the most, the people who we live with, we work with,
Yep.
we're in relationship with. And so I really hope that women take advantage of this opportunity to really change course. It's never too late. I don't even care where you are on the metabolic health spectrum. It's never too late. It's
Yep.
never too late. And to the point that you made, so much is tied to how we live in our lifestyle.
Right. And it's never too late nor too early. So
Yes,
just because you're
true.
young,
Yes.
just because you're young doesn't mean that your A1C
So
might
true.
not be going where it doesn't need to be going.
Oh,
And so
yeah.
this is an opportunity to, if you are already experiencing burnout, how we can maybe reduce burnout. And if you're not experiencing burnout, how you can prevent it. And the
Yes.
tools that you can use for either of those things to serve us, because we think that oh, I'm young and I'm thin and I'm fine, and that's wonderful, but that comes with its own set of things, right? Like
Right.
folks in their 20s and 30s, they carry their own stress. So yeah, it's not the same stress as
Hmm.
somebody in their 40s and 50s, but it's stress nonetheless. And we are seeing, because of the advent of modern technology and the changes of food and just air quality and all the many, many things that we can sit here and list, how cortisol levels and metabolic markers are, um, you can probably use the right terminology. I may use the wrong terminology here, but basically we're seeing that younger people are showing higher
Oh,
mark.
certainly.
Help me out here, Dr. Evan. You're the
Yeah,
expert on that.
certainly. I'm thinking of a few I saw last week in the office,
Mm-hmm.
and I'm checking them because, I'm starting to see more and more. I know the family history, and then I'm
Mm-hmm.
starting to see, I'm collecting lifestyle information data from what they're reporting, and then I see physical signs on exam. And so, every week, unfortunately, I'm becoming like less and less shocked because the
Wow.
labs just match what the presentation is.
Yeah.
But it is wild because we weren't dealing with this like 10 years ago, 20 years ago in such a young population to the prevalence that we are now.
Right.
And that's also goes back to changing the legacy for those who are coming behind us, for those who are watching us now,
Right.
and for those who will continue to come behind us.
Yeah. And so you're seeing it from one side, and as a clinician, I'm also seeing it. So when again, in the work that I do, I like to have my clients say, if they're like, I'm not sleeping well, I'm not feeling good, I'm like, you know what? Go get some blood work done. Go get some blood work and let's have a conversation. Let me know where your blood
Mhm.
pressure is. And, like, let's talk
Right.
about what you're eating. How are you sleeping? How are you identifying with yourself? And I've had clients that when I first started seeing them, were reporting that they were not sleeping well. And, they'd go to the doctor and I wait too much or whatever have you. And then several months later, when they go back to their 6 month physical or whenever they, oh, I happen to go to the doctor for whatever reason. But, oh,
Hmm.
Yovanna, my blood pressure went down. Oh, okay, cool. Like I didn't even
Hmm.
know that you were going to the doctor, but thanks for the information. And what that tells me is loosely that the mental health work that we are doing, when they're reporting that, provided some tools, they are now sleeping better. Provided some tools, they are feeling less stressed. Provided some tools, they have more clarity. Their anxiety is reduced. Even I have, I think, two or three clients right now that are managing their ADHD, and through
Hmm.
just having tools, they're like, I've restructured my time and I feel more rested and I can think better. And it's just incredible how a little bit of structure, a little bit of mental structure, a
Right.
couple tools that, with a little bit of help, you didn't know that you needed it, but now those same folks that are like, I have ADHD and so therefore I can't, or I have anxiety and so therefore I can't. When we start to restructure thoughts that impact behavior, which impacts
Hmm.
your metabolic health, and it does this beautiful, beautiful cycle. And then to see how those clients thrive, it's such an amazing thing.
That's awesome. A little structure is freeing. You wouldn't think those
Yes,
things go together, but
correct,
structure can be freeing.
correct.
You're mentioning the clients. I do want to point out, so there's a clarity reset, but then you also have a private practice, right?
I do. I have a private practice where I serve women, again, high achieving women in Georgia, in DC, and Virginia.
Mm.
It is virtual. I am currently seeing clients, and I absolutely love what I do. It is what I was designed to do. It's like my divine
Yes.
purpose. And I do the work that I do in part because I know what it is to feel like that high achieving person that's just trying to do all the things and getting away from the core of who I am as a person. I've
Mm.
had that experience. I've had the experience of having to manage trauma. I've had the experience
Mm.
of managing, ill parents. I have a disabled child. Like I know what all of that looks like and feels like, and I know how that was showing up in my body. I
Mm.
know how not appropriately managing those things, how that was showing up in my self identity, and how that was just, I was feeling separate from myself. And in doing my own work, even before becoming a clinician, doing a lot of my own work, I was like, oh, I was just a separate version. I was just like these pieces of myself that were not
Mm.
together. And in the work that I have done because it is a relationship. So the more that I work with clients, the better I become. So they become better, I become better. And I'm sure you have a
Yes.
similar experience when
Hmm.
you see your patients too, Dr. Evans, is
Exactly.
right. It's a beautiful relationship and it's
Hmm.
such a sacred thing to execute. I just gave myself chills, but it's true, like to be in this healing place. And I absolutely love the work that I do. I wouldn't trade it for the world. But these are the conversations that I like having because even before becoming a therapist, I was a personal trainer. And
Yeah.
so understanding like the interest of the body and the interest of the whole self and how all those things play together has always been top of mind. You know, our overall health has always been top of mind for me. And so I appreciate having some education and some information that is valuable to this conversation and then conversations as well to, to our populations so serve them better.
Yeah. You have a lot of education and a lot of experience, and there's nothing that can match that combination. Even in my
Yeah,
experience now, being, all the years in, education and experience go a long way.
they really do. They really, really
Yeah,
do. And the passion, and the
exactly. You're correct. You're
yeah, and
correct.
the clarity of purpose. Like I know you have clarity of purpose because you
Yes.
care for your patients in such a intentional and
Oh,
deep
thank you.
way. I observe how you are with your patients and how you take your time and you listen to your patients, you educate your patients in ways that, like, we really don't see that in a lot of medicine nowadays. And so to see how the time that you take, the care that you give, your patience, the way you listen, and then you care for the whole family, which is amazing.
Yeah, sometimes I really ask myself, is this real life? Because I feel fortunate.
Yeah.
It has so much fun, but you're correct. It's that walking in purpose and what you're called to do.
Yep.
And I could not have imagined this is beyond my expectations. You mentioned early on it's a partnership between like Healthy and Clarity Reset, and Healthy is almost 7 years old, and I'm
Wow,
just
congratulations.
yeah, thank you. But it's good, and I think through that relationship building, the need for this and the next program and the next program
Yeah.
has really been highlighted because I can only do what I can do.
Right.
There's plenty that is needed that's outside of my skill set and my training. And so I'm grateful for partnership, for collaboration, so that we can treat people in their entirety. People can heal wholly because some things don't come from a prescription or a supplement.
That's right.
They come from connection and community and new skill sets about how to reset. So we're out here just trying to help the whole person, help the whole family,
The
help the
whole,
community, help
yep,
our worlds.
100%. Thanks for that confirmation. Yeah,
Oh,
it
yes.
is, especially in the times that we're in, there's so much we're dealing with a lot of like our own stress but then we also have a lot of that external stuff happening as well. And my take on this and why I'm the most excited, like you were saying about the caring for the whole person, caring for the community, is now more than ever, we have to care for ourselves. We have to be in alignment
Yeah.
with ourselves. We have to care for ourselves fully so that we can endure the various changes that are happening around us, which are outside of our control. But what is in our control is
Yeah.
how can I care for my mind? How can I care for my body? How can I care for my soul? And by doing that, then how can I care, like you were saying, for my loved ones, the people who I care about, and my community? That more than ever that is richness. That is the wealth that will
Yeah.
carry us through and will give us the oomph that we're going to need to get through these changing times. And I'm
Yeah.
really actually optimistic that more people come to these type of resets, a clarity reset, coming to healthy, and are like, you know what, I'm going to care for my whole self because I deserve it. First of all, despite what other people think
Hmm.
I deserve to be whole, I deserve to be well, and so do the people around me. And so that is
Yeah.
what I hope that folks take away from the clarity reset is the wellness, the wholeness, and the endurance.
Yeah. You said care for ourselves fully, and I
Yeah.
was adding in my head and unapologetically. Oftentimes, I see people deprioritize their own care
Yeah.
in the interest of serving those around them. Like, oh, let me take care of this person, that person, this business, this manager, this client, this customer, and we
Hmm.
keep putting ourselves on the back burner, and that's no more. Like that,
We're
that's
done.
we left that in 2025, you know? So
You took the
new
words right out of my
year.
mouth.
Yeah, new intentions like that's I often think about like how self-care is strategic and that can be defined all these different ways. So we do have to prioritize our care. And if it
Yes.
means, these group sessions, this cohort, this investment of time and resources, that's the investment will yield dividends. Like the payoff will be in ways that we can't even measure.
100%.
So yeah, it's time to prioritize ourselves
Yeah, like,
because yeah,
no, go ahead. I'm sorry.
no, because it'll pay off.
It'll pay off. And there's several adages of what people say, right? It's like, health is cheap and illness is expensive,
Oh
or
yeah,
you can pay for example, the Clarity Reset now, or you can pay a hospital bill later. And
oh yeah,
I do part-time medical social work, and I work in a hospital, one of the large hospital systems here, and I see what illness does to folks. And I see how expensive it is and how devastating it is for families.
hmm
And like you were saying, the investment of time and the investment of resources, which in the grand scheme of thing is minor compared to like a hospital bill, right? Compared to that
yeah, you're
MRI that you got to
correct.
get, or the whatever it is. We're doing 6 sessions starting March 11th. We're running through April 15th, which is we're kicking it off during Women's Health Month, which was
Yes.
brilliant on your part, Dr. Evans. We're kicking it off during Women's Health Month. It's, an hour on a Wednesday midweek, so not the Monday crazies or the Friday lazies. It's right in between. And it's wonderful. And if you missed the sessions, they're available for replay. You can download them and
Yes.
available for replay. So nothing is lost, everything is gained.
Yes, and we were talking about like hospital bills and things like that, but then there are the costs that may be harder to measure, may not be as direct, but
Yeah.
the cost to our productivity when we're not clear, the cost to our performance in the workplace and our home when we don't have the clarity, when we don't have our metabolic health optimized. And so I can just imagine the testimonials that will come out of people spending this time, women spending this time to really achieve that reset. And yes, yeah, and
Yeah.
yeah.
You're absolutely right. I work in the corporate space as well as a corporate wellness consultant, and have done executive coaching. And to your point about the cost of that mental clarity, when I've worked in the corporate space with directors, executive directors, one of the main reasons why I've had to work with them is because their performance was lacking,
Yeah.
and they were feeling as though they were not communicating well with their teams. They're going through attrition. It was a mess, and that was taking a hit on their health. And so again, this circle of the cycle, right? And by the end of working with them, just offering them tools, right? Allowing them to think more clearly and to take that hour of time that we're working together as a respite. Um, Happy to report that they report that productivity has gone up for them. And ultimately, I mean, look, if we're keeping it a buck, if we're talking about work, it's the bottom line too, right? And so,
Right.
so, you know, um, they feel more productive, they feel more in their purpose, their teams are thriving. And so again, that win-win, no losses, all gains.
Yes.
I'm really excited to be working with Healthy and Dr. Evans to bring to you the Clarity Reset, where we're going to be working with high achieving women who want to reduce stress, increase wellness, and create balance in their lives. We kick this off March 11th. It's going to be every Wednesday at 7 p.m. through April 15th during Women's Health Month. And what are
Yes.
we going to be covering during the Clarity Reset? We're going to talk about stress reduction, burnout reduction, mind body wellness, how to get more sleep, how to get more rest, the rest that you deserve. And so I hope that you were to join us. Clarity Reset. You can go to the link in my bio. Dr. Evans will also have a link, and let's do what is absolutely best for us high achieving women that think we're doing the most, and we are. We deserve all the rest.
Yes, we do. Yes, we do. Well, I enjoyed discussing this with you today. This is
Thank
just
you.
a highlight of what we've been talking about through the years.
Mm-hmm.
But I'm excited about this partnership and what it will mean for our community.
I agree. I agree. This is great, Dr. Evans. It's nice to see
Yes.
you in this environment and have these conversations. And, we have talked about these things for over the years, for a long, long, long time over the years. So this is not like new to us. This is true
Exactly.
to us.
There you go.
And I
Exactly.
love that for us and I love that for the women that we're serving.
Yes, yes. All right, take care.
You do the same.
Thank you.